morning. I'm Amy Anderson, Government Affairs Director at AWB. We had a legislative session this year that some are saying is one for the books. Today, we will be talking about one of the key bills to come out of this session regarding healthcare. Thank you for joining us today. We have a great lineup of speakers with timely and relevant information to share with you on this bill. Before we dive into today's program, just a reminder that AWB's Workforce Summit is coming up on July 21st and the Housing Forum on July 22nd. These will both be hybrid events and limited in-person tickets available and will be held in Tacoma, Washington. Save the date for now. More details will be announced soon. Now on to the program. Today we're talking about the Long-Term Services and Trust Program. If you have questions during the webinar today, look for the Q&A icon in your Zoom control panel. Type your question there and indicate which speaker it is for. Please note, questions placed in the chat may be missed, so please be certain to use the Q&A feature. So let's dive in. Joining us today, we have Ben Veghte, Washington Cares Fund Director, Washington State Department of Social and Health Services, Janette Benham, Leave and Care Division Rules Coordinator with ESD, and Kelly Linseth, Leave and Care Division LTSS Program Manager, also with Employment Security Department, as well as Christine Hawkins, Associate at Davis Wright Tremaine. Thank you, Ben, Janette, and Kelly. Right now, we'll start with Ben and Janette on their presentation and then move on to Christine for remarks regarding that. Afterwards, we'll be doing questions and answers from our audience, so please be prepared and start putting those questions into the Q&A form. Ben and Janette, take it away.
There is an age wave, as you all know, that is coming. The number of people 85 years and older is projected to more than double between 2020 and 2034. So it's a very short period of time over which the population most likely to need long-term care is projected to double. Similarly, the number of people 80 to 84 and 75 and older is also projected to double over the coming years. Because of this, the challenges for the state general fund are growing. Today, in the past biennium, about 6.4% of our budget was spent on long-term care, but with the doubling of caseloads over the next 2 decades, which will come in accordance with the increase in the population that is over 75 and 85, we are likely to see a tremendous increase in the share of the general fund going to long-term care. Obviously, that is not sustainable. That would lead to significant tax increases to meet the need, or it would lead to rationing of care, probably would lead to some combination of both. Because of those challenges, the state enacted the Long-Term Care Trust Act, which is the program which we now call the WA Cares Fund. Next slide. So why does the program exist? The WA Cares Fund was created to support working Washingtonians with affordable long-term care and peace of mind that as we age, that we will have coverage when we need it, so that we don't have to quit our jobs, reduce our work time, turn down promotions, et cetera, in order to care for parents, and our children won't have to do that for us. The program provides a new way to fund long-term care that keeps people from having to spend down their life savings to rely on Medicaid for care or pay premiums after retirement to retain a private plan. It allows families to focus on care needs and not their finances when long-term care needs arise. Next slide. So why do families need a new approach to long-term care? Our current way of paying for care at the time we need it is very expensive, and most of us can't afford it. For most of us, if we live long enough, it is not a question of if we will need Medicaid long-term care someday, but when we will need it. Only about 7% of the population has long-term care insurance, and only about 3 or 4% of people under age 65 have it today. Diane and her family experienced a common and predictable path to Medicaid. There was a need for care. The family stepped in to help, but couldn't continue for various reasons, such as burnout, need to maintain their jobs, or other family needs. And because Diane's dad did not financially qualify for Medicaid, the family had to pay out of pocket. They exhausted their life savings, and Diane's dad soon became impoverished and qualified for Medicaid long-term care in order to get care. This is obviously none of our family's vision for retirement or aging. And what the WA Cares Fund do is to offer a new approach that provides an alternative path to families to help manage this challenge. We know that most households nearing retirement lack sufficient savings to pay for long-term care on top of their normal living expenses in retirement. 1/3 have no retirement savings, and half have less than $4,200 saved. So half of families 55 to 64, families approaching retirement, have less than $4,200 saved for retirement. So paying for care out of pocket is simply not a viable option for them. And no one wants to go on Medicaid for their long-term care needs because that requires spending down all of your life savings. So this program offers a different way. Next slide.
Thanks, Ben. I just want to go over some key dates and the path to WA Cares. The final passage, as you all know, of a fully funded paid family medical leave program in Washington didn't happen overnight. It was the culmination of many years of work by legislators and advocates from around the state. This is similar to the WA Cares program. And as you can see from the slide, there are 6 years that will pass before program benefits will be available. In 2019, the state legislature passed SSHB 1087. In 2020, ESD requested legislation, which was passed in SSB 6267. In 2021, House Bill 1323 passed, which allows individuals disabled before the age of 18 to participate in the program. It clarified vesting requirements. It required long-term care insurance be purchased by November 1st of 2021 for individuals to qualify for an exemption. And it added requirements for self-employed individuals to opt in. It made additional clarifying changes. And beginning in 2021, on October 1st, ESD will begin accepting applications for exemptions. And exemption applications will be accepted through December of 2022. We'll talk more about exemptions later in the presentation. In 2022, key date for employers is January 1st, when employers will begin deducting premiums from employee wages. And then January 1st of 2025, the benefit will become available for qualified individuals. Next slide, please, Kelly.
So how will the Washington Cares Fund support Washington families? It will do so in three main ways. So first of all, affordability. Until now, long-term care insurance has not been affordable for the vast majority of the population. For the first time, long-term care insurance is now affordable and available to all working Washingtonians. It also makes it affordable for the state to meet our population's long-term care needs as they age in a way that will, and despite the growing age wave, the state will still be able to keep pace and support families in their long-term care needs because of the new revenue stream that the new program brings. Peace of mind. We all know, and all of us who have aging parents or grandparents know we all have at least one person in our family or extended family who had to deal with long-term care challenges. We all know the stress that can put not only on our financial situation as a family, but also on emotional relationships where dependency relationships change. People who used to care for you now have to care for them. It's a really difficult situation that families find themselves in. And none of us want to be putting our own children in that situation that we found ourselves in vis-a-vis our own parents or grandparents. And what a program like this does is make it available to all of us, that we know that we don't have to worry as much about that as we age, that we know that there's a program in place which will provide a solid foundation for our long-term care needs as we age, and then it won't burden our family and financial and emotional relationships. Finally, choice. Surveys show that families highly value the ability to choose, whether they can age in their home, stay in their home as they age and need long-term care. Many people today end up having to go to a nursing home because they have to go on Medicaid. That's the only kind of long-term care available to them. And for some people, that is only possible if it's a nursing home rather than staying at home. What a program like this does is give everyone sufficient resources and a budget which will allow them to control their own situation as they age. They can stay in their own home if they want to. They can have whatever mix of professional and family care they want, which we'll talk about more later. So it gives families choice as they navigate this challenge. Next slide. So how does the benefit work? Well, I'll talk a little bit about the benefit itself, and then Janette can talk about the vesting process. The benefit provides $36,500 worth of care to an individual. That will be adjusted roughly for inflation over time, but that's the starting benefit in 2025. And the benefit can be used for a range of services. It can be used for professional care, either a home care aide to help you stay at home, or a wheelchair ramp, or bathroom remodification to make it easier for you to stay at home. Or if you prefer to go to a facility, whether it's an assisted living facility or a nursing home, it can be used for that as well. What's also a really interesting aspect of this program is that you can also use it to help pay for a family member who's providing care for you. So if you prefer not to have professional care, but to have your spouse or a child care for you, they can receive compensation for the care they provide you, which helps keep that money in the home and help you meet your financial challenges as you go through this as well. Next slide.
So I'm going to talk a little bit about how the benefit works. Vesting and eligibility. First, you must become vested by working and contributing at least 10 years over a career without a break of 5 or more years, or 3 of the last 6 years. And in each of those qualifying years, you must have worked at least 500 hours. You must be at least 18 years old to qualify for the benefit, and you must need assistance with at least 3 activities of daily living. So if you do need that assistance, what will happen is your vesting eligibility will be checked and determined. And if you are a qualified individual, you may be entitled to receive the benefits if you need at least 3 activities of daily living. And that assessment will be done by DSHS and the benefit offered by DSHS. Next slide, please. Moving on into a bit more about how the program will work. This is based on employee contributions. All Washington employees will contribute starting January 1st of 2022. As you can see, it's a little over 0.5% of wages. So for a person whose annual income is $52,075 per year, they'll contribute $302 for that year. Go ahead on to the next slide, please, Kelly. So I want to talk about exemptions. This is where we're getting the majority of our questions right now, because this is the first part of the program that is going to be implemented. So what are exemptions exactly? Exemptions are for workers who have their own private long-term care insurance. And this was written into the statute to allow those individuals, if they choose to be exempt from the program. It's really important to note that exemptions are permanent. If approved, workers won't have premiums assessed, and they'll forfeit their right to the benefit for life. So once an individual applies for an exemption, they're exempt for life, and they won't be able to participate in the program. Individual workers must apply for an exemption. We've had several questions that have come from employers who do offer a long-term care benefit, wondering if they can apply for the exemption on behalf of their employers. And that actually isn't allowed, because those individuals may choose to keep this WellCares Fund benefit to supplement any private long-term care insurance that they have. So key dates for exemption applications: by November 1st of 2021, individuals who would like to apply for an exemption must have a qualifying private long-term care insurance policy in effect. ESD will be accepting applications for exemption from October 1st of 2021 through December 31st of 2022. And I just want to mention that ESD is actively writing rules regarding this program, and the rules for exemptions have just been adopted, and they will be effective June 7th, even though we aren't accepting applications for exemption until October 1st of 2021. ESD's rulemaking website is, you can get there from the main ESD page. It's esd.wa.gov/rulemaking. And there's a long-term services and supports link there where it'll take you to the rulemaking page. Next slide, please, Kelly. So I want to talk a little bit about employer and employee responsibilities. Employees must provide notification of their exemption to all current and future employees. So once an employee applies to ESD for an exemption and attests that they do have long-term care insurance that was in effect prior to November 1st of 2021, they'll receive a notification of approval from the Employment Security Department. And they have to provide a copy of that approval letter to all current and future employees so that the employers know not to deduct premiums from those employees. The only acceptable notification to the employer is a copy of the employee's approved exemption letter from ESD. If an employee attempts to claim an exemption to the program, they are not entitled to that exemption unless they do have the valid approval letter from ESD. And employees will be able to log into their portal account once they apply and are approved to obtain additional copies of their letter in case they don't make additional copies for employers, since they have to show this letter to all current and future employers. So once an employee is exempt and they have provided the notification to employers, the employer should not collect premiums from those employees as long as the employee has provided the approved exemption letter. And I want to talk a little bit about refunds to the program. So reporting for long-term services and supports, or the WA Cares Fund, is going to be similar to the paid leave program. Reports will be quarterly, and exemptions will become effective the quarter immediately following approval. So all of the exemption letters will have the effective date of the exemption, and the exempt employees, as mentioned previously, will be exempt for life. So I want to give an example for this last bullet here, that employees are not entitled to a refund of premiums that were assessed and collected before their exemption was approved or before the approved exemption letter was provided to their employer. So if premium assessment begins on January 1st of 2022, an employee applies for an exemption in April of 2022, and remember that applications for exemption will be accepted from October 1st of 2021 through December 31st of 2022. So this employee has applied within the application window. So the employee was approved for their exemption at the end of April. Their exemption will be effective the next quarter, which is July 1st of 2022. And the employee will get an approval letter from ASD. They must provide that letter to their employers, and premiums should be assessed for that employee until their exemption is effective. And from July 1st on, premiums should not be assessed for that employee. Premiums that were assessed from January 1st of 2022 until their exemption is effective are not refundable to the employee. And I wanted to go over that just because we've been getting several questions about why the difference in the date we begin collecting premiums and the time window that employees may apply for an exemption. So I hope that helps to clarify that. Next slide, please, Kelly. We want to talk a little bit about the similarities and differences also between paid leave and the WA Cares program. So employers don't contribute for the WA Cares program as they do for the paid leave, but employers will collect premiums, as we've mentioned, beginning January 1st of 2022, and they'll report and pay those premiums to ESD. Several of the definitions for the paid leave program refer back to the WA Cares program. The definitions for employer, employee, and remuneration are consistent with paid leave. And the definition of wages also applies, excluding the Social Security tax cap, which does not apply. So for paid leave, premiums are assessed on wages up to the Social Security tax cap. But for WA Cares, all wages are assessed to premium. That's the only difference between premium assessment on wages for the program, other than that employers don't contribute. Self-employed earners can opt in to the WA Cares Fund program, and there's additional guidance that and additional parameters that were put around that in House Bill 1323. Next slide, please, Kelly. And we want to make this as easy as possible for employers, because since there's a whole nother program to report, there's been a lot of unease and unknowns and questions coming up about how reporting is going to work. So employers will report once for both programs. We're trying to make it a unified reporting experience and make it as easy as possible. We're in the process of updating the paid leave reporting system to include WA Cares. There's, like I mentioned, many similarities between the programs. The definitions of employee, employer, employment, and wages, with the exception to the Social Security tax cap, are the same. Employers will deduct premiums, report, and pay those premiums to ESD, the same that they do for paid leave. Self-employed and federally recognized tribes can elect coverage. And employees covered by a CBA in existence on or before October 19th, 2017 don't have to participate unless the CBA has been reopened or renegotiated after that date. And this language, as do so many of the definitions for the WACARES Fund, refers back to the paid leave law, which has the exact same language regarding CBAs. And to the extent possible, we'll investigate for premium compliance for both programs too. Next slide, please. I want to talk a little bit about how WACARES is different from paid leave. The benefit for both programs, they're very different. As Ben mentioned and went over, the program for WACARES serves a different purpose than paid leave. There's no employer contribution. The premium amounts are different. And as mentioned previously, there's no Social Security wage cap on premium collection. And one of the main differences between WACARES and paid leave is that ESD doesn't administer the benefits portion of WACARES. For paid leave, of course, you all know we administer the benefit for that. So it's a little different in this program because we have several different state agencies that are involved in working together for this. ESD, though, will track the vesting period based on the work and the contributions. And as I mentioned previously, if someone is in need of a benefit, in order to receive that benefit, they would have to ensure that, or actually ESD would be tracking, and we would ensure that the person has met the vesting requirements in order to become a qualified individual to receive the benefit. Next slide, please.
So the WACARES Fund is a collaboration across 4 agencies. DSHS is the lead agency, and we work with, I'm hearing an echo there. DSHS is the lead agency, and we collaborate with ESD, the Healthcare Authority, and the State Actuary. So the Department of, so I'll start with the Employment Security Department. ESD is responsible for matters which take a greater priority in the early years, starting now, processing exemptions, collecting premiums from employers, et cetera. The Department of Social and Health Services will receive claim applications, administer benefits, so that when people are actually applying for benefits, they'll do it through a portal that we're developing. And we also are working to develop a provider network that will meet the needs of our aging population. We are also applying for a shared savings waiver with the federal government to help recoup some of the money that we're saving for the state Medicaid program by offering this new program. The Healthcare Authority is a partner who is working, they provide the Provider One system, which is the means by which providers of long-term care, home care aides, nursing homes, et cetera, they bill the state through the Provider One system, which the Healthcare Authority runs. So they're going to be a key partner once benefits start to be claimed to help with that component of the program. And we work with the Office of the State Actuary. The State Actuary monitors the program's finances, tracks projected revenues and spending over a 75-year time horizon to make sure that we are on track. This program is entirely funded from worker premiums. It does not impact the general, it does not receive any money from the general fund. It simply saves money for the general fund by reducing the degree to which we have to pay for long-term care through the Medicaid program. Next slide.
I want to go over ESD's communication and outreach timeline. In January of this year, we hired communications staff and we launched a weekly program email to division staff so that our agency can ramp up for implementation. In April, we launched a website with program and contact information, and I'll give you the website address here in just a minute. And in May this month, we have our bi-monthly employer outreach email launching, and employer toolkits and resources are published on the website. The website has a lot of valuable information, and I've noticed in the chat in Q&A, there's several questions that have been asked that are included in our FAQs on the website. So I think it will be really great for you all to be able to go onto the website and just do some exploring. It was a joint effort by DSHS and ESD to launch this website. And we this month are also beginning offering internal program seminars, and we will have our FAQs and training language updated and delivered to our customer care staff to prepare them to answer the calls that we have coming in. In July, we are hiring LTSS customer WACARES customer support staff, and new website will be released with additional features. And in September, I really want to highlight this, that this is something that we're actively working on. We'll begin offering webinars to employers and business organizations, and we'll have video tutorials for employers on our website that you can download and view at any time in order to prepare for reporting. In October, our outreach efforts will take center stage for DSHS and ESD and will continue through the end of the year. And in December, ESD will prepare a Secure Access Washington platform for final integration and changeover. I also want to mention too that between Q3 and Q4, we are developing the online applications for exemptions that will also be available on our website. So the website that I have been referring to is wacaresfund.wa.gov. And it was put in the chat. You can go ahead and click on that. It's a great website. Feel free to explore, and we are constantly adding content. So it's not just a one and done. There's no additional information on there. We are constantly receiving feedback on website content and adding additional information so that it's available to anyone who use the website, and we'll also be updating our FAQs based on the questions that we do have coming in. Next slide, please, Kelly. And again, there is the website, wacaresfund.wa.gov, and contact information for Ben and I. And are we turning this over to Christine at this point?
Thank you, Janette and Ben. Yes, I believe Christine probably had some comments and overview from the employer and employee perspective. A lot of questions that they've been receiving from some of their clients, I think will be extremely helpful given the information you've given. Once we have Christine speak, then we'll head on back, and we've been getting quite a few questions from our audience for you all. So we'll definitely address those as soon as we can have Christine up on the screen.
Great, thanks,
Thank
Amy.
you, Christine.
Thank you. So thanks again, Janette and Ben. That's such a great, helpful overview. I think that answers a lot of questions. As we can see from our Q&A, we've got quite a few questions coming in too, so we'll reserve some time at the end to discuss those as well. I want to reiterate a little bit about what Janette already talked about in terms of what are employers responsible for and what are they not responsible for. Right now, really, there's not a lot that employers are responsible for. Certainly, we're seeing a lot of employers who want to provide communication and outreach to their employees, and we certainly encourage that. You know, of our clients, it is difficult. They're fielding a lot of questions where there aren't necessarily answers yet, but that is one thing that employers can do right now. Employers, once the opt-out period begins, they'll be responsible for kind of tracking their employees who are opting out, collecting those exemption letters, as Janette mentioned, making sure that those are tracked and kept in your records, so that once the payroll tax begins January 1, you're not subjecting any employees who did qualify to opt out, that you won't want to withhold any payroll taxes from those employees. What are employers not responsible for? And I do want to emphasize this. Again, you're not responsible. There's no contributions that employers are making, like with the paid family medical leave program. You're not responsible for offering alternative coverage. Employers aren't responsible for helping their employees determine if the other coverage they have qualifies for the opt-out, although we certainly see those questions coming in too. Employers are not responsible for applying for the opt-out. And as Janette mentioned, employers really cannot apply for the opt-out. I saw some questions come in of, if we do offer a program, for example, and we know which employees are enrolled in our other long-term care program, can we just provide a list and opt out on our employees' behalf? And the answer to that is no, as Janette said, that it really is an individual determination. The employees will need to go in, I believe, on a website individually, certify that they do have compliant other coverage, and then they make the choice of whether to opt out, because it is an irrevocable choice. And that would go, beyond if they were ever to leave employment with you and then no longer have that coverage option in place. At that point, they're not eligible for the state program because of their opt-out. What are the biggest challenges and kind of the questions that we're receiving? I think, as we can see from our 41, 42 questions that are in queue right now, a lot of the challenges are that there are many questions, and I think many that are still going to be addressed in the rulemaking process. So I would say the number one question or number one challenge that employers are facing right now is really fielding these employee questions, trying to help explain the rationale behind the program, why certain individuals will be paying into the program potentially, but won't be eligible to receive a benefit. For example, if they're close to retirement, or if they are working across state lines and don't reside in Washington, for an example. The localization rules, I think that's one. We saw a lot of questions in the PFML context, and we use the same definition here for what employment means and who's subject to the payroll tax. And so we've gotten very similar questions where, the general answer is if you are withholding and treating your employees as subject to PFML, they would also be subject to the new Washington Cares Fund program. But particularly in the past year, where we have employees who are working across state lines or who are working remotely, and we might not actually know where they're working from, really keeping in mind that those localization rules, can be tricky, particularly where the employee isn't both employed in and working in Washington, but where we do have people who are splitting their time between states or who maybe were working remotely. And keeping in mind in that communication strategy for, I think, especially in Washington here, where we have employees who are crossing over from Oregon, from Idaho, but who don't live in Washington, making it really clear to them that they wouldn't be eligible for the benefit, even though they are paying into the program, because they don't reside in Washington. Other challenges, really just the tight deadlines around everything, right? I mean, everything's rolling out very quickly. The November 1 deadline, it's great that it was pushed back from July, but it does still present a very tight turnaround, particularly for employers that do want to offer other coverage to their employees. Just the challenge of being able to get other insurance, an underwriter in place, and then also communicating this, educating employees so they understand the potential, risks or pros and cons of both programs. I guess lastly, in terms of challenges, just tracking those developments. And as Janette mentioned, again, the new Washington Cares Fund program, I keep checking it almost on a daily basis, and I'm seeing, more and more information, more and more. There's an employer toolkit now. There will be regular bulletin posts that employers can share with their employees. So we are seeing more information shared there, which is I think a great resource for employers. There's also a place for employers to sign up on that webpage so that they can be sure to receive notifications of any new developments. But those are really the challenges we're seeing, is there are just so many unknowns, so many questions, and really trying to field these questions. Employers are, for the most part, kind of being put in the middle of the state as they're rolling this out, and their employees who will be subject to the tax. And again, trying to answer these questions, trying to prepare employees for the payroll tax that's to start on January 1, and really trying to help them explain the opt-out process and exemptions. So I do want to reserve time. I know that's a quick explanation. I think Janette and Ben did such a great job of covering just the general criteria of the program. And I know we're up to, I think, 50 questions now in queue. So Amy, do you want me to turn it back over to you? Do you want to field us questions? Let us know how you want to best approach some of these outstanding questions we're getting.
Sure, great. Thanks, Christine. Yeah, like I said, we've got quite a few questions from the audience. And we'll try to get through those. Just a reminder to the audience, we will be sending out the link to we are recording this. We'll send out the link to this recording as well as the PDF of the presentation so that you will get that. What we'll also do, we have about 20 minutes maybe for Q&A. For all those that we don't get to, we'll put together a list of those questions that were not addressed, that the ESD, DSHS, and Christine folks, and then Christine who can answer those if they're applicable to the perspective they're coming from, and hopefully have them answer those, and we can get those out in the email that we send with the links as well. So let's go ahead and get started. And Christine, I'm going to keep with you here for a second because you did talk about employees, employers who may have employees living in Idaho, Oregon as well, that they're working here in Washington State for Washington State employers, so they are paying that payroll tax even though they are not eligible for the benefit. We did have a question from a company who is a global company, so they have some of their employees who are working in Japan might come into the state for 3 to 5 years to work. They are exempt at a federal level from Social Security and Medicare taxes. Is that the same for this program, or will they be paying that this payroll tax for the 3 to 5 years that they're here?
Yeah, and I think I saw that Ben had actually responded to that question as well. And I think the answer right now is that they would be subject to the program. There's nothing in the rule that exempts them, but it does sound like that is something that Ben and his team have flagged as a potential consideration going forward for these individuals who are working here on a temporary basis and who would never become eligible for the program.
Great, thank you. And I appreciate you you all kind of chiming in on the Q&A piece and see if we can get some of those answered. We did have one very specific question come in prior. Do individuals who are considered corporate exempt officers for purposes of L&I have to pay into the long-term care trust account?
I'm going to send that one over to Ben or Janette and their team. I don't think it's particularly clear from the actual rules, but I know there's been some, I think, internal administration or interpretation of that.
I'll go ahead and take that one. Corporate officers are considered employees of the company they work for, and this is the interpretation for paid leave also. Just like for paid leave, they will be required to participate in the WA Cares Fund. And a lot of the time we do respond with, like Christine mentioned, if they are paying in for paid leave, they would also be paying in for long-term services and supports or the WA Cares Fund, unless they have an approved exemption and are exempt from the WA Cares Fund program.
Great, thank you. Next question. You did touch on, Ben and Janette, in your presentation of once you opt out, you are opted out for life. If you have an employee, so AWB provides long-term care coverage for their employees. Let's say I'm here, I leave and I work for another company who also provides that coverage. Do I lose my opt-out, or do I have to re-opt out? How does that work?
I'm happy to take that one if you want. I know that's a question we've been getting quite a bit. And Janette, Ben, chime in if I'm wrong, but my understanding is, again, once you opt out, you are out for life. So if you have that coverage in place when you apply after October 1, then you will be eligible, you'll be out of the program. So if you do transition to a different employer or you otherwise lose your existing long-term care coverage, you're still out of the program. So at that point, you're not subject to the tax because you no longer have the program in place that you had at the time of the exemption. But you're also, you're not paying into the program, but you're also not eligible for the benefit at that point.
So can a person then opt in if they go to a different company that doesn't offer it and they haven't purchased a product? Can they opt back into the program, the state program?
No, there's it's a very limited window. And we get a lot of questions that we're getting to relate to the collective bargaining agreement exemption, for example, where those individuals might not be subject to the tax as of January 1. So many are thinking that they don't need to have other coverage in place by November 1 if they want to later opt out once they become subject. But my understanding, at least to date, is that that's not the case, that there really is a one-time limited opt-out window. So for people who aren't subject, who are self-employed, who are covered by a CBA, who are under age 18, those individuals, will be subject to the tax when they become eligible or when they become subject to it if they haven't opted out prior.
So just to confirm, because we did get a question about this as well. So our future workforce, they're not out there working. We're all here working. We have the option to opt out if we have coverage up through November 1st, if we purchase it by then. So our future workforce, even if they have it, they will not have the option to opt out then. Is that correct?
That's correct. To give you some context, think of it like Medicare. It's very much like Medicare. It's a universal program where everyone pays in and everyone benefits. There is a one-time grandfathering of people who had coverage prior to implementation, specifically by November 1st. If you have private coverage by then, there's a one-time grandfathering of that. But programs like this don't work. Like Medicare wouldn't work if everyone could opt out perpetually. What happens in that case for any insurance, and anyone who works in the insurance field understands this because it's part of what they do. When you have voluntary participation, you get spiraling of premiums. You get adverse selection, which can cause premiums to go up significantly. And so to keep premiums low, it's important that everyone be in. And the state looked at other approaches. They looked at approaches that would build on the private insurance sector to get broad coverage. And they found that they couldn't get past about 10% of population coverage through private insurance, regardless of what they tried. And so the state wanted to develop a policy that would help all Washingtonians, not just 10% of people. So this policy is aimed to just like Medicare or Social Security, to support everyone, not just those who can afford private insurance. And that's why they took this approach. Now, if you want to go down this road as a policy decision, it needs to be universal. If there were perpetual opt-out, the premiums would have to be much higher, which would make it unaffordable for many. So that's why it's done the way it is.
And I want to add to that, the future workforce, the way that the exemption process and the exemption statute is written is that individuals do have to be 18 or older to apply for an exemption. So those who will not turn 18 prior to December 31st of 2022 will not have the option to opt out because there's only that limited time period for opt-out.
Great, thank you. Quick question on taxability of this. Will the premiums be pre-tax? Will the benefits be federally taxable? Was there an IRS waiver required, or is there one pending?
Yeah, I attempted to answer that in chat, and Janette may want to build on this, but she can build on answer the premium part. But in terms of the benefits are not taxable at all to the beneficiary. This is a service reimbursement benefit. It's not a cash benefit. So the benefit one of the reasons we did it that way was so that it wouldn't be taxable. So providers provide benefits, providers get reimbursed through the healthcare authority. The beneficiary doesn't owe taxes on any of that. Now, if they have a family member who chooses to serve in the role of a long-term care worker and care for them and get paid as a worker, that person would have some income that would be taxable. But for the beneficiary, it's not taxable under any circumstances. Janette, you want to talk about the premiums being pre-tax?
Sure. And Christine, you might want to, if you would like to chime in on this too, please feel free. The easiest answer to this is that if wages are subject to a premium for paid leave, they are also subject to the premium for WACARES fund. Since the definitions for WACARES fund refer back to wages and remuneration for paid leave, the same wages would be assessed a premium for WACARES.
So just a clarifying piece on that then, are pre-tax retirement plan contributions included in the calculation of premiums?
I am looking at the definition of wages right now to make sure that I answer this question correctly. Could you know this one off the top of your head?
I don't. So I'll defer to you on that one, Janette.
Okay. And if I'm not able to answer this question right now, I will definitely make sure to get back to you, Amy. So maybe we can follow up on this as we'll probably run out of time for all of the questions too. So we'll definitely follow up on that.
And while you're looking at that, we did have one question about can you please provide 3 examples of activities that do impact daily living?
Sure. Being able to basically what long-term care is it's not medical at all. It is when you have trouble living independently. And we all know this from parents or grandparents who went through this. If you have trouble getting in and out of bed to go to the bathroom, to bathe yourself, to feed yourself, to get around the house without falling and hurting yourself. So it's the inability to live independently, needing support from another person to help you do those basic activities. And about 50 to 70% of Americans turning 65 today will need long-term care at some point as they age. We all think we'll never need it, but more than half of us do end up needing it. And when you do need it, it's really nice to have funds available.
We did have somebody ask, you mentioned that an employee can supplement with individual and state. Can you clarify, can an employee have both?
Yes, absolutely. You can totally have both. For many people, it's advisable, even if they have work, for example, if they have group coverage now, most people don't maintain that group coverage into retirement. Very few people have employer coverage when they're 25 and still have that coverage when they're 80, right? Because this is about when you're 80. It's not about when you're 30 or 40 or 50. This is not disability coverage. This is long-term care. You can have both. We're also working specifically to design a new insurance product together with the insurance industry. Those discussions are going to begin this summer to try to design supplemental policies that could take the $36,500 benefit that WellCares provides as a deductible and therefore make the policy much cheaper for people to afford. So those policies, if they do get developed, which we're working to work on with insurers, will probably have a much lower premium than a general long-term care policy has today. So down the road, I think that's probably going to be the most attractive option for people to have this as their base benefit and then purchase a low-cost supplemental policy. But those policies don't exist today. That's something that we need to work on with the industry, and hopefully we can develop those products.
Good. Thank you. That's good to know. Going back to number of years and eligibility, how does this work for those who are close to retirement age and won't meet the time and work for requirements to qualify for the benefit, but don't have a long-term care plan? So can you go back and revisit how long you have to pay into it or how long you are in the workforce, that time frame?
Do you want me to take that one, Janette, or would you rather take that? Sure. So this is a challenge that we're continuing to work on. But first of all, none of us really know exactly. I mean, unless you're a state worker or a federal worker, or you probably don't know exactly when you're going to retire. Most people, unless you're very close, surveys show that people, when you ask people when they're going to retire, they give you a certain age or date, and then most people don't retire at that time. So it's hard to predict. But for people close to retirement, if you've paid in for 3 years, you'd have temporary vesting, which would give you coverage for an additional 3 years after that. So if I'm 62 and I retire at 65 and I pay in for 3 years, I'm covered until I'm 68. So if I'm 67 and I've paid in 3 out of the last 6 years and I needed long-term care, I'd be eligible. But that's temporary vesting. For permanent vesting, you need to pay in for 10 years without a 5 or more year interruption. Now, we're aware that there's a problem that many people close to retirement won't be able to vest for the permanent vesting. And that's an issue we've flagged for our oversight commission. That's something that they're going to think about to see if there's a way to address that challenge. Obviously, it's a difficult policy issue because this is an entirely self-funded program. So everybody's premiums is supposed to pay for their benefits. So if somebody paid in 1 year and paid in $300 and then got a $36,000 benefit for paying in for $300, that would hurt the solvency of the program and would drive up premiums for everyone else. So it's an actuarial question as well as a policy question. It's something that is complicated, but we flagged for our oversight body, the LTSS Trust Commission, and they're working on seeing if there's some policy options they could develop to make that work better.
Great, thank you. Christine, I do have one for you pertaining to exempt populations. Are there specific populations who are exempt from participating in this program?
I think under the latest rulemaking, the exemptions that apply are self-employed individuals. Again, people who are covered by collective bargainings that Janette had the date in her program, but that haven't been reopened or haven't expired since that date. I believe certain federally recognized tribes are also exempt. Janette, let me know if I'm missing any.
Federal employees.
Federal employees, yes. I should know that. My husband's a federal employee and just told me that yesterday.
And for tribes, there's a nuance here, which is that the law didn't talk about tribes because there's tribes are sovereign, and so they wanted to wait until they had time to negotiate with tribes. We're doing that negotiation now jointly with ESD, and it could be that a tribe or multiple tribes decide to opt in. But that is only for tribal employees. That affects tribal employees. If a tribal member works for a non-tribal employer, they are covered by the program. It's only that the only people exempted with regard to tribes are tribal employees, because that's currently the statute. But if someone works for a non-tribal employer, they would be covered, and wage premiums would be.
Great, thank you. Going to the opt-out process by ESD, and you did mention that, I think Janette, you said that if you are eligible to begin not having that payroll tax taken out the quarter after you receive your approval letter. So the question is, when will ESD begin issuing exemption approval letters, and what happens if it takes months to get those approval letters out?
That's a very good question. We will begin accepting, as I've mentioned, applications online, and we've made the application process as easy and as short as possible based on the anticipated number of exemption applications we're going to get. And this was a really hard number to estimate. And based on what we have estimated, we are hiring staff to process those applications. And the application is a very simple application. You enter your personal information. There are check boxes, and in that checkbox is an attestation. And then by submitting the application, it is the attestation that you do have the long-term care insurance. Also, there is just a identification document requirement for applicants to upload. And it's really hard to estimate how long and if at all we're going to be backlogged. And I know, coming on the heels of paid leave implementation and the significant delays in the number of applications received, that this is a concern, and we're trying to combat that and plan for that. And so we have staff coming on to be able to process those exemption applications, and the applications are not going to be as extensive, requiring ESD staff time as they are for paid leave. So we're not anticipating a backlog. We're hoping there's not going to be a backlog, and without being able to give a specific, we'll have applications processed within this amount of time. We'll do our best to get them processed as soon as we can.
Thank you.
And I also do have the answer to that wage question.
Good.
The premiums are assessed on gross wages.
Okay. So the tax-free or the tax exempt retirement plans you will still be taxed on that.
Correct. So yeah, gross wages before any deductions.
Great. Thank you for getting that.
Sure.
Now, we've talked about employees who do work in other states. If somebody is working here in Washington State, retires from a company here in Washington State, but chooses to move to a different state, can they access the benefit, or does the care have to be given in Washington?
Currently, the care has to be given in Washington. This is an issue of which the state is aware as a challenge, but it's a difficult policy challenge that our oversight body is going to continue to think about ways to deal with that. But it's challenging because care out of state is unregulated. You don't know who's providing the care, if they've had a criminal background check, if they're being paid substandard wages, if the older adult is safe with that caregiver. Those are lots of issues that we have to solve before the state could sign off on that. And so in the original legislation, it was not possible to receive care outside the state. That's one of the issues that the state is thinking through over the medium term. But as things are today, you have to be in the state to receive care.
And Ben, you have to both reside in the state and also receive the care in the state. Is that right?
Yes, we haven't really gotten to that level of specificity in designing how that's going to be implemented, but I think that's kind of a gray area currently. But
okay. Yeah, I saw a question come in about kind of on that same topic in terms of if with Snowbirds, for example, people who split their time between here and Arizona, let's say, I think that's still kind of a gray area in terms of what does it really mean to then reside in Washington and when they'll be eligible to receive the benefit.
I think the main issue is that the care is provided in Washington
Okay.
rather than, but we haven't gotten into the specific, no one's trying to make it difficult for people to get benefits. It's more concerns around, making sure that people are safe when they receive the care, but yeah.
Great, thank you. I think it's definitely clear there's a lot of questions to be answered and some things to work out. I'm going to do one more question before we wrap this up, because we did have a lot of questions around the collective bargaining agreement exemption. Can somebody go over that one more time so that we have a good time frame around how those impact the opt-out and the eligibility there?
Sure, I can talk a little bit about that. So again, this is the same as it is for paid leave. If employees are party to a collective bargaining agreement that has not been reopened or renegotiated since October 19th of 2017, I believe is the date. I don't know why that's such a hard date to remember. Then they would not be subject to it. So the same as for paid leave, if an agreement has been opened after October 19th of 2017, then once the agreement's reopened, those employees are subject to paid leave premiums. And the same would be true for WACARE's premiums.
And just to add on that, I think the kind of confusing issue then is that there's not a subject opt-out for those individuals. So they would need to, if they know that their CBA is going to expire or be renegotiated, obviously it's going to be renegotiated at some point in the future, and they know that they won't be exempt at that time. If they do want to opt out, they would still need to opt out within the limited window period and have coverage in place by November 1. There's not a separate kind of exemption that applies to them that gives them a different time period.
Great, thank you. Well, Christine, Ben, Janette, thank you so much. There's a lot of questions left here. Obviously, as Ben said, a little bit of gray area still out there, but we had almost 200 people here with us today. So you can see the level of interest, and definitely people are wondering what's going on with this. So appreciate your time today. We will get the recording out to all of our participants along with the PDF of the presentation. And then if you all don't mind, we will send you the questions. And if we can get some more of those answered, we'll be able to send that out to the participants as well. So thank you again for taking the time. And thank you all for logging in here and watching. If you do have any additional questions, please don't hesitate to reach out. We appreciate you taking the time, and thanks for being with AWB today.
Thank you, everyone.
Yeah, thanks everyone. Thanks, Amy.